Hi everyone, my name is Dr. Arit Ntekim. I went to Ithaca College for undergrad where I studied biology and chemistry. I took a gap year. In that year, I worked as a pharmacy technician and I really enjoyed the work that I was doing there. And so I went on to pursue a dual degree in my doctorate of pharmacy as well as my master's in public health at the University of Maryland in Baltimore. In fact, immediately after graduating, I went on to Rutgers University to get my medical degree, my MD. My specialty is radiology. I really enjoyed many specialties in medical school, but I found that I really liked the intersection of medicine and technology, and radiology was that perfect balance. And so that's why I went on to pursue that, and I'm currently at Brown University. So I was a clinic coordinator for DVIP, which was a student-run program at Rutgers for women who were experiencing domestic violence and displacement from that. We offered those women OBGYN care and primary care. I also worked as a student doctor at our student-run primary clinic, which focused on providing primary care to our local community. Those experiences were so fulfilling, and they really allowed me to understand the intersection of healthcare and medicine and primary care and public service. I believe the key to success in medical school is really learning to balance medicine, public service and community service, and self-care. Medicine is a field that requires a lot of work. It's a very intense field. It requires lifelong studying, lifelong learning, and it also requires you to give a lot of yourself as a provider. When you are taking care of patients, you have to be very thorough. And so I think the most important thing is recognizing that those are your key roles in the career, but also balancing self-care and things that are important to you. I think students, I found that really understand that balance always do so well, and they carry that through each stage of their career. I think the most important thing when it comes to counseling students and ensuring that they are able to achieve their goal in getting into medical school is really finding the unique things about the student that we can highlight and makes them stand out to admissions committees. But just kind of finding those key things that really make you unique and highlighting that and focusing on that, not just in the personal statement, but even in your interviews. People love to hear the stories that make you you and make you unique. And so that's what I focus on in counseling. And I think that that has worked for all the people that I've worked with. I think my greatest strength as a coach is that I've worked with a lot of students through the medical school application process. I myself have gone through it, and I've also been through other terminal or graduate level degree admission processes, and I've sort of learned what is important in general into getting to graduate programs, and more specifically healthcare programs. So I've learned what admission committees are really looking for. I also think that I am very flexible. I understand sort of how to kind of use things that sometimes we might think are not important or might not make us stand out. I kind of find those things and work on them to create a narrative and help you create a narrative that you can use in your story about yourself. I've also worked with many students through programs through my actual medical school that prepared students to go on to become medical students. And I've worked with them in terms of application, interviewing, and that also kind of helped me get a greater perspective on what things do students sometimes find difficult and how do we approach it and overcome it. And so those are kind of my greatest strengths. I'm passionate about helping medical students because I received quite a bit of mentorship and guidance through my application process and through becoming a medical student. And I mean, it was invaluable. I can't even put into words how far that support took me and even is keeping me now. And I think that I want to be able to offer that same experience and that same support to other people who are going to be doing the same thing. I think the greatest thing about medicine is that medicine requires you pulling others up, and I really want to be able to offer that to someone else, just like people did for me. And I want to be able to support people and students through their process and through their journey and be a resource to them. And that's really why I'm passionate about helping medical students. Thank you all for listening to me and viewing my video. And I really would just like to encourage anyone who's interested in medicine and applying to medical school to really go after your passion, move forward with the things that are important to you. And if that's medicine, looking forward to working with you. Bye.